My name is Kara. The reason why I came to Ketamine Clinics Los Angeles is because I had been frustrated and kind of feeling at a loss with other treatments and medications and therapies that I've tried in the past. I feel like I've been struggling with depression and anxiety for quite some time, and I was at this place of hopelessness and thinking that nothing was really going to help and that I was never going to get better. And then I came across Ketamine Clinics Los Angeles online, and it all sounded really great, like a treatment-resistant approach to depression, anxiety, and PTSD, and I wanted to give it a shot. I was really suspicious at first because, nothing had worked for me in the past, so I was kind of in the same mindset of, is this really gonna help me? Is this really gonna work for me? But I'm really glad it did, because it made a really dramatic, profound impact on my life since undergoing treatment. Yeah, so other treatments and therapies that I've tried in the past, it feels like I have been on every medication that they could prescribe: SSRIs, mood stabilizers, anti-anxiety medications, and I just feel like they didn't help me very much, or they helped me only minimally, or they kind of just made me feel numb, and it wasn't really all that helpful to me. And as far as therapies, I've been through years of individual therapy every week for 5-6 years. I've done group therapies, CBT, DBT. I've been inpatiented in mental health facilities doing intensive inpatient and outpatient programs. And to me, none has been more beneficial than the ketamine treatment that I've been through. It's really hard for me to describe what the ketamine experience is like, just because it's so different than what I experience here on Earth in what we call reality. It really takes me away from all of my worries, everything that feels important here, on Earth, the life that we do every day. All of that seems to melt away when I'm in the ketamine journey, when I'm in the ketamine infusions. It just really feels like I get to explore me, and I don't feel like I really knew who I was, or I didn't know who I was, or I never really got the chance to meet myself until the ketamine infusions. Well, I realized that I'm a lot more than my experiences here on Earth. I don't know if that makes sense. I feel like a lot of the pressure, a lot of the depression and anxiety and stuff that I felt on a daily basis were because all of the expectations placed on me here in the world that we live in, whether it be succeeding at work, or what other people perceive of me, or making other people happy. I feel like I realized I'm more than that, and that's something that's really beautiful. I also didn't realize how beautiful life was, and how rare and unique that this experience is, being human. And that's what really I took away, because I was really suicidal when I very first came here, and the ketamine treatments made me realize that to throw that all away would be the foolish decision, the most foolish decision I could ever make. So after the initial 6 infusions, I've come back for, I think, 3 boosters since. No, I haven't had any suicidal thoughts or behaviors or ideations or anything like that since. I feel like whenever I did feel like I was getting back into that slump, or when the depressive thoughts and feelings would come back, that's when I knew it was time to come in for a booster, and it helped dramatically. It just put me right back on track. I would say that I felt better almost immediately. As soon as I felt the effects of the ketamine, I feel like it just helped immediately. And as soon as I walked out of the building, I just had a new perspective. So it was pretty dramatic, and that was something that really surprised me about this therapy, is I came in really suspicious. I was probably, one of your most suspicious patients going into this. Even my therapist was suspicious and called Dr. Mandel directly and was saying, "Are you sure this is a good idea? Do you know how bad she is, like, as far as suicidality? Like, she's been inpatiented twice within the past 3 months. Like, are you sure this is an appropriate treatment?" And I was surprised, and my therapist was surprised, and it's just really amazing, like, and profound, like I said earlier, how dramatic it is that I could feel like so deep and lost in that depression, and then the ketamine therapy really just pulled me out and made me see the world differently. So yeah, one of the big things that I realized from the ketamine treatments is like how rare and special the human experience is, and I really took that for granted before, and I'm just really learning the importance of love. Like, without all of these other layers of what we have to do here on Earth, I feel like love is by far the most important, and making connections to other humans is the only real thing that we have in this world. You know, if you take away money, if you take away fame, all of that's all going to be gone when the sun explodes. So like the only real thing that we're going to remember, like on our deathbed, or that we're going to take away from this life that we have here, is that love and that connection that we have with each other. And the ketamine therapy has really given me like the courage and the bravery to really seek out those connections, when before I just felt like I'd been so hurt and traumatized from the past that I was really anxious, really socially anxious, and really suspicious of everyone. And I didn't really want to engage in, you know, having relationships with people, whether they be friendships or romantic partners. I just felt like I had given up on that. And yeah, the ketamine therapy really helped me learn that vulnerability is something beautiful and something that I shouldn't be afraid of. I mean, I've struggled with addictions in the past. I feel like I've been addicted to cannabis. I feel like I've been addicted to just other things, like codependent relationships, and but no, I don't feel like ketamine is addictive. I mean, it's really great and beneficial, and like it feels great, but I don't have that drive or the desire to get my fix like I did with my addictive behaviors before. If anything, the ketamine has helped me kick my addictive behaviors that I had in the past. Like before I came in here, I smoked cannabis all day, every day. Like it was the very first thing I did when I woke up in the morning, and it was like the last thing I did before going to bed. And I did that to cope. And if anything, I feel like ketamine actually helps treat addictions, and to me, it's not addictive. So the criticism that ketamine treatment is expensive, I feel like that's a valid concern, because that was something that I was apprehensive about before starting. Not just my hesitancy because I didn't trust the clinic. That was something that I also had to work through. But another thing was, I saw the price tag and I was just like, wow, what if I spend all this money on this treatment and it ends up, not working? So that was something that went through my mind too. And I also thought the same thing, like, how can somebody like me who, I take care of animals, I pet sit for a living, and I don't come from a wealthy family, I'm not in the entertainment industry or anything. So I also thought, like, is this for me? Like, it's kind of just, sometimes you hear people say like, oh, it's just for, the rich Beverly Hill elite that they come in, just for fun, or just for, like, I don't know, creative exploration. But I really feel like this treatment should be accessible to anyone, and I really feel like it will benefit everybody. And I found a way to be able to afford it, and I'm really glad that I did, because I wouldn't be in this place that I am now. Like, I just found a way to make it happen. Like, I I got a new credit card, I moved around some money, and I really put together my priorities, because ultimately this was a life or death decision to me. So nothing was more important to me at the time than my mental health and getting me back on track. So that's what got me to pull the trigger and to make the investment, because it really is an investment in myself. It's an investment in my life, because if I didn't do it, I don't know if I would still be sitting here today talking to you. So it's expensive, but it's worth it. So as far as side effects for the ketamine treatment, I didn't experience much at all. Once I got nauseous, but that was only once out of the dozen or so infusions that I've received. And I feel like the staff was really empathetic and in tune to that, and it hasn't happened again, like me being nauseous or vomiting. And another side effect, but it's not a side effect of the ketamine, it's a side effect of the Zofran, which is the anti-nausea medication given before the treatment, is just like mild constipation or like digestive issues after that. But other than that, I can't think of any other side effects that I experienced. Long-term side effects? No, I can't think of any. No. When I came here to Ketamine Clinics, the environment, as far as like the space where I'm being infused, I'll restart that. The environment in which I received the infusions at Ketamine Clinics is really comfortable. I mean, it is a clinical setting because it is a clinical practice. Like, it's a medical procedure, so you just have to kind of accept the fact that it's going to be a semi-clinical setting. But I also was made to feel very comfortable by the staff, by the nurses. I had a choice in like what music I got to listen to. They were very caring and made sure that I was comfortable the whole time. They even went so far as like if I needed to adjust midway through the infusion, that all I had to do is press the button and they would come in and help. So I just felt really comfortable and really at ease as far as the environment goes during the infusion. If I could go back and tell myself, like pre-infusion, anything, I would say that everything's gonna turn out okay. If I could say one thing, that's what I would say, because I just had so much that I would worry about, and I would take something, relatively small, and I would allow that thought or allow that feeling to consume my whole life and judge myself and think I was a bad person, and I would be overwhelmed with guilt and shame. And I just felt like that all the time. And I felt like everything I did was my fault, or everything that bad that happened or that I experienced was somehow my fault. And really, I realized that everything's gonna be okay. Everything's gonna be fine. If I'm having an uncomfortable or a bad experience, it'll pass. And the universe is really functioning the way it should. And I just have that trust now when I didn't have that before. Yeah, sure. So as far as the route of administration, I feel like it's really important the way the ketamine is delivered to the body, because I have experienced ketamine treatment in other routes of administration. For instance, sublingually, like the lozenges, and also I've also went to another clinic that did intramuscular injections, and I feel like those experiences were vastly different than intravenous ketamine. I feel like with the intravenous ketamine here at Ketamine Clinics Los Angeles, it really is able to be altered, or you can change the dosage from patient to patient or from experience to experience. So you can tell the nurse that, maybe I'm not feeling it, or I would like to go deeper into the journey, and they're able to change that like on the spot immediately. When with other routes of administration, like with the lozenges or with the intramuscular injection, you're kind of just given a dose and then you have to write out that dose without any changes. So there's that to consider as far as route of administration, but also I feel like intravenous therapy gives you a chance to go deeper into the journey and have a more immersive experience. Like, you really get disconnected from your human body, like the room, even the planet that you're living on, at least for me. So I feel like it's more therapeutic to get to that point in the journey versus kind of just maybe mildly feeling it. So it was more beneficial for me compared to the other routes of administration that I've tried. I very much think intravenous therapy is superior. Okay. So I think therapy in conjunction with ketamine treatment is really important. I think that you should definitely continue to seek out therapy and go to therapy, the same week, the same months after the ketamine treatment. But as far as when you're in the actual journey, I feel like that's the time to be really self-reflective and to really explore that world. And like I said before, really get to know yourself and meet yourself. And I feel like if therapy was administered during the same time that the ketamine effects were, taking place within the body, I feel like it would be a bit distracting. I'm not entirely sure because I've never tried that before. I've never done therapy like in the middle of a ketamine experience. But to me, I just feel like that would be a bit distracting because, like I said, it's really the time to be introspective and to be really fully submersed into that world. And then after the fact, you could discuss what you experienced, what you learned during the journey, and then you could process that with the therapist afterwards. But I think during the infusion or during the treatment, it might not be as beneficial as some people might assume. Like I said before, I was just really surprised in terms of the effectiveness of the treatment. Before, I mentioned I was really suicidal, and it got so bad to the point where I would wake up every morning and just kind of be plotting my own demise. I would have a list in my head and make plans. Like, I need to go through my stuff and get rid of anything that people might find when I'm gone that might be embarrassing. I have to find new homes for my cats, which was really heartbreaking for me because, they're the only reason why I was able to make it up to, that point. So they meant the world to me. So that was kind of like next level that I was considering, like, finding homes for them. And then I also felt like I had like this really mean, like, suicidal bully that was just pressuring me into doing it. Like, why don't you just do it? Like, it'll all be over if you do it. And then I lived in downtown LA, and I lived in this, skyrise building, and I would just be terrified of myself because I knew all I had to do was go up the elevator and jump. So, sorry. But, so I was in that really dark place. And it was just really something to have this treatment, just go in and just be so helpful, because I was in the mental hospital twice and I was at a loss, and I just really, didn't think anything was going to help. And I was just so hopeless, and this was kind of my last resort. I said, I'm going to spend my money on this treatment. If it doesn't work, then it's over. And I'm really glad that I did, because like I said, if I didn't, I probably wouldn't be here talking to you today. It really did save my life. I know that sounds like cliche or, canned, but it really did. And I think like that's the most powerful thing that I can say. And it is effective in terms of treating depression or anxiety or PTSD or other disorders. But I really feel like for me, the biggest difference that I saw was that just the elimination of the suicidal ideation, and it just completely interrupted my plans that I had before, which was amazing. I would like to say to anybody who's maybe reluctant or interested or maybe like apprehensive about trying it, those are all valid concerns, because I felt them as well. Like, I was worried about the cost. I was worried about whether or not it was actually going to help me, because I was so hopeless before that nothing else had. I was scared about the experience. I was afraid of letting go. I was afraid of what I was going to discover in my journeys. but it'll, like I said, it'll all work out okay. And it's okay to process those feelings in the journey too. Like I processed my fear. I processed my my tendency to be reluctant of others, or apprehensive of what they might say, or being not trusting of people. But really, it's a plunge, but it's a good plunge to take. And what you gain from the experience is so much more than any of like the feelings of apprehension or fear going into it. I think once you take that plunge, all of those concerns and fears that like I had experienced before, they really seem like mild and trivial. So yeah, it's just being open and really like seeing what the experience has to give for you. That's just how I really feel. Like I remember feeling like I just didn't trust this place. I thought this place was a scam. Mm-hmm. I didn't trust your dad. I remember he called me after like the very first one, and I was just like, why are you calling me? Like, what do you want to know? But now and that's just kind of like a memory that's so in the past, you know. It's like it's kind of tied to those suicidal behaviors that I had before, and it really doesn't seem that powerful anymore. So it's like kind of hard to say to tell somebody who's in that mindset. It's hard to convince them that it'll all be okay, because now I have the knowledge it'll all be okay, it'll all be fine. So it's kind of hard to talk to that person and be like, relax. Like, they have your best interests at heart. Like, they do this because they want to help people. Like, but I'm having a hard time just like trying to express that, if that makes sense. Because I'm just like at a place now where I've grown and I've learned so much that it would be hard to try to convince me then. I just know that like I've heard it so many times before. People would tell me everything's gonna be okay, everything's gonna be fine, the universe is unfolding as it should. I just didn't believe it. And I didn't start believing it until after I'd been through a few infusions, and then I got to see it for myself, that everything will be okay. And I didn't know that until I knew it. You know, so it's hard for me to tell that person because they won't know until they know it too. So, yeah, just take the plunge. Like, it's scary, but it's worth the experience. And I feel like that's all of life. Life is scary, but it's all about the experience. It's all about the journey. So, yeah, so in terms of choosing the right clinic for you, I would definitely do your research, because there are a lot of other clinics popping up that seem to be like more trendy or more kind of catered towards a certain clientele, or maybe a different lifestyle. But it was really important to me that the providers were experienced, that had been like doing this sort of therapy for a while, who you know, had good reviews, and that was just an established clinic for a while, because they like so many are popping up. And then also the route of administration was also really important to me. And Ketamine Clinics LA checked all those boxes. Like, they have a physician that has been in this field for I don't even know how long, a long time. And Ketamine Clinics has been around since 2014. So they have like an established reputation within like the mental health community. And I had also read so many reviews about how beneficial the treatment was to other people. So I definitely did a lot of research before choosing a clinic, and I'm glad I chose Ketamine Clinics LA, because yeah, they really are experts. They've been doing this for a long time, and it shows.